Catheter insertion into a vein is generally done for one of three reasons: to replace fluids, to give medications, and to repetitively draw blood for testing purposes. Practitioners should be aware of local protocols and follow them at all times. Your goals are to create a safe, non-threatening environment and to gain consent for the procedure whenever possible. These goals can best be attained by explaining to your patients the reasons for the procedure and describing the steps needed to accomplish the task. In order to gain the confidence and cooperation of your patients, begin by making them as comfortable as possible, and then inform them about the procedure at hand. Address patients using language that would be understandable given their age and background. In some cases, this may require an interpreter. After you have discussed the procedure and answered all questions, gather the necessary equipment and bring it to the patient's bedside. When selecting equipment, gather everything necessary to successfully complete the procedure. Leaving the patient's side during the process could prove detrimental to both patient and process. Sound planning and preparation will eliminate the need to interrupt the procedure to call for help or seek additional equipment. Base your equipment and insertion site choices on the reason for insertion and the patient's physiological condition and diagnosis. Although it is important to bring everything you need to the patient's side, take care not to overstock. Overstocking is cumbersome for you and costly to the patient and/or the institution. Limit your equipment to the things you absolutely need, plus one extra catheter and several wipes. When assessing the need for catheter insertion, you will need to decide whether to place a lock or start fluid. If the catheter is being placed for multiple blood draws or delivery of medication, then a lock, a small plug with a reusable rubber stopper, is placed into the hub of the catheter. Before use, the lock must be flushed with saline to prevent clotting. If the patient is to receive fluid therapy, choose and prepare a bag of fluid with tubing prior to inserting the catheter. Check packages to ensure sterility. Pay special attention to packages of fluids. Check the expiration dates and examine the packages carefully to determine if there is any contamination of the fluid by foreign bodies. Before inserting the catheter into the vein, ready your equipment for securing the catheter. Inspect the outer packaging of the catheter for watermarks. If watermarks are present, discard that catheter and choose another one. Tear off the amount of tape you will need and place it nearby. If you will be using bio-occlusive dressings, make sure that they are within reach. Ready your locks, and if fluid will be attached, flush the tubing to facilitate quick stabilization of the catheter and connectors. Be sure to maintain sterility of the site and equipment during this procedure. Here is a detailed description of the equipment and supplies necessary for IV insertion. Constricting bands are generally 2.5 centimeters or 1 inch in width and long enough to encircle the entire lower or upper arm. The band should stretch easily and can be made from a number of different items, such as surgical drains. Constricting bands are meant to occlude only the venous flow, allowing for engorgement of the vessel chosen for cannulation. Arterial pulses should still be felt in the distal extremity when a constricting band has been placed. Never tie the constricting band in a knot. Catheters range in size from small, 24 gauge, to large, 14 gauge. Base your catheter selection on the patient's condition and size, and the insertion site chosen. The smaller catheters, 22 and 24 gauge, are often used in the hand or for the elderly and children. The mid-size ones, 18 and 20 gauge, are used in the forearm and for patients who are going to surgery or receiving medication. The largest catheters, 14 and 16 gauge, are generally placed in the antecubital fossa for fluid replacement in trauma patients. Cleansing wipes may either be alcohol or iodine solution. Both are used to cleanse the skin of any bacteria that may be present. Use only alcohol if the patient has an allergy to iodine. Use of specific cleansers is based on local protocol. Personal protective equipment such as gloves, goggles, masks, and gowns should be chosen on a case-by-case basis. Although gloves are always worn, masks and gowns may be optional in certain situations. When you are fully prepared with all the appropriate equipment, return to the patient in order to complete the procedure. Don your gloves. Make sure they fit snugly, and inspect them for tears and holes. Never tear off or remove any part of the gloves while you are wearing them. Begin the procedure by asking to view the patient's arm to check for the patient ID band. Gently turn the arm, view all potential insertion sites, and select the most appropriate one based on the patient's condition and reason for insertion. Ask the patient if he or she has any known allergies. Check specifically for latex and iodine allergies. If a latex allergy is noted, use all non-latex products. If an iodine or seafood allergy is noted, cleanse only with alcohol. Apply the constricting band 10 to 15 centimeters or 4 to 6 inches above the chosen insertion site. When the vessel engorges, palpate it for straightness and sponginess. Then begin the cleansing procedure. Holding the alcohol pad or iodine swab in your gloved hand, wipe in a circular fashion from directly over the proposed insertion site in ever-increasing outward circles. Allow the wet area to air dry, or wipe with sterile gauze. Do not blow on or fan the site. Open the film covering the catheter and remove it from the package. Work the plastic top off of the catheter, taking care not to contaminate the needle itself. Take care not to slide the catheter back and forth over the needle, as this may cause damage to the catheter sheath. With your non-dominant hand, grasp the patient's arm or hand. Use your thumb to gently stretch the skin over the insertion site. This will help to stabilize the vessel. Hold the catheter in your dominant hand and turn it so that the bevel is facing up. Inform the patient of the imminent stick to decrease the likelihood of the patient moving while the catheter is being inserted. Quickly insert the catheter at a 10 to 30 degree angle into the vessel. Look for a flash of blood in the chamber. Advance the catheter approximately 1/3 of a centimeter or 1/8 of an inch after the flash is seen in order to seat the catheter in the vessel. Advance the catheter forward in the vessel over the stylet until the hub rests against the patient's skin, but the stylet is not fully removed from the catheter. With your non-dominant hand, occlude the vessel above the insertion site at the tip of the catheter. When the vessel is occluded, remove the constricting band by pulling on the loose end. While still occluding the vessel, remove the stylet and dispose of it in the sharps box. Attach either the lock or the tubing from the fluid to the hub of the catheter. Be sure that whichever system is used, it has been appropriately flushed prior to attachment. Secure the catheter with an adhesive dressing. Since there are many methods used for securing catheters, follow the local protocols and procedures. Flush the lock to maintain patency. Check the site for swelling, pain, redness, or tenderness. If any of these signs are found, immediately remove the catheter and dress appropriately. Remove and dispose of all used equipment. Place any blood-spattered items in the appropriate biohazard containers. Regardless of where you work, whether in hospital or in the field, the technique of IV insertion requires practice.